So brothers and sisters who are fit and healthy, no comorbidity risks, that means no underlying illnesses such as heart disease or diabetes or whatever. They should be adults, so it should be above the age of 18, and they need to be under the age of 60, because just generally we want to reduce the risk. Now, is there a risk? There is. This is not me saying that this is completely absolutely possible for every single person to follow this process. The Royal College of Pathologists in the UK, the Public Health England in the UK, the CDC in America, the EDC in Europe, a number of the professional bodies that are involved in postmortem and pathology have declared that the risk of transmission, of infection of COVID-19 is low. It is low. It is not zero. There is a risk. That risk is primarily, as you're going to see when I demonstrate on the body itself, that risk is primarily coming from the bodily fluids that may come out during the ghusl, and any exhalation of any fomites, or rather any form that the virus may spread from the mouth or from the nasal mucosa. And for that reason, we want to make it clear that this is not without risk, which is why, of course, the guidelines from NHS PHE have excluded any vulnerable people, those who have these conditions or who are of elderly age. And of course, in our community, the majority of the people who fulfill this process are of the elderly, are 60, 65, the most experienced uncles and aunties or Masajid workers, and so they are out of the game immediately. So we need a load of volunteers to come forward, and you will see details of that spreading over the next few days in preparation for the next few weeks. We're expecting this to become a very serious problem. That means keeping the body cool, and that reduces any risk of evaporation of any gases or any respiratory products that are coming up from the body of the deceased. If there was a situation where there was no cold storage, and there were bodies that had been left at room temperature for any appreciable period of time, then theoretically it's possible that in a sealed body bag, which has got no air going into it, that there could be some gases. So it would be with your mask on, it would make sense just to open that up slightly, just a little, to ensure that you're not near it, and if there is anything that needs to come out, then it comes out. So once we have just opened that bag up a little bit, the first thing that we're going to do is just to expose the head. The first thing that you're going to do is to get some cotton and to seal up the nostrils. Gently, of course. The Prophet ﷺ commanded us to be very, very careful with the deceased. And then the mouth. In this case, there is some sellotape on there because this is used to do a demonstration. Of course, you don't want to, but just imagine that has now gone in the mouth, and then you will get a mask. And the mask itself will then be applied to the body itself. What I want you to know is that you will do the ghusl with the deceased having the orifices closed, and this now attached, and it will be tied to the actual ears. I'm going to have to remove this for this process because the dummy itself does not have that does not have the earlobes to hold on to it. Then the body is carefully opened because you do not know whether it's in a state of undress or not. And so you will carefully open it up, and also because there may be some fluids to the side and left, and so you need to be careful with that too. So you will carefully open it. Most of the time the body will be fully clothed, or it will be in a hospital gown, and so it will be safe to open it up entirely. If you're not sure, you'll just open it up and keeping it together like this, and then you will just make sure that the aura is covered. If the body is naked or it's only a very flimsy hospital gown, then keeping the part together, you will then get a thick towel or a biggish towel or a big sheet, and this sheet will remain on the body throughout the washing process. You will cover this in this manner. You will then open up the body bag and then transfer the sheet to the body itself. Being careful with the body bag itself because that is seen as contaminated waste. Of course, you need to have your dustbin to hand, which will be for contaminated waste. once the body is covered, this is going to remain here for the entire process, which is why normally it's a thick, heavy towel so that it doesn't come off during the washing process. Once you have now got the body bag off, you will either, if it's nice and simple, you will just slip it off. If not, then you will cut it off. You need to have your scissors there, and then you would then go through and you would cut the clothes of the deceased into its pieces, and this would have 2 people, 3 people, 1 on each side, ensuring that that happens, and then together, then you will then gently. So I would then lift the head. So for example, Ashraf, if you just come. And so I would then lift the head, remember it will be covered, and then this will be slid out underneath. And that's what would happen all the way. So you will take this off gently, and once that has been taken off, you will gather it all together, and you need to make sure that your contaminated waste bin is close by, that its lid is already open. Just like, for example, this one here, you will just have it close. You will make sure that it doesn't have the lid on, it's been open, normally has a key. Just pick up and just drop in, and that's it. And that would also be the case for every other thing. Just drop, drop, drop. You don't be flapping around with this too much, and you keep it at a distance so it doesn't get too much in the way. So the next stage is to now do the obligatory aspects of the ghusl itself. Now, as I said, this is not a video showing the sunnah aspects. If this was a normal non-COVID patient, then we would not only do the istinja and properly as well, we would ensure that we have something physical on our hands to clean the orifices properly. We would be pumping the body itself very gently to ensure that we expel any fecal matter. We would then be very, very hands-on. After we done the wudu, then we would then ensure that we would then rub the body. This is not going to happen in this particular case because it's a COVID patient. We're going to be minimizing the amount of contact that we have with the body, but at the same time, we're not touching the body. You've already done that when you have transferred the body itself physically. That's the reason why you're wearing gloves. That's why you're going to wash yourself afterwards. We're going to not avoid not touching the body in its entirety. 2 people will then do this process. In principle, you will have your buckets, couple of buckets ready. The water should be nice and warm, treating the body with respect, and you will be doing this in a way that you're minimizing any kind of splashing. Now, ideally, if you do not have a bucket, then you will have a hose that has a cut-off end, not a shower head. We cannot have forceful shower coming out. Water's going to go everywhere, splashing everywhere. But if you have a gentle hose that will literally just come straight out like from a tap, but in a very, very gentle, close manner, then that's something else that you can use. In the absence of that, and using something like this, there's very, very little you can do. And I want you to understand that what we're trying to balance is between those people who are insisting that we're not touching the body, it's infected, it's this, which is not what the official guidance says and not what our religion allows to treat the Muslims when that risk is low, versus being irresponsible and increasing the risk for absolute no reason. So that balance is difficult. And I'm going to be very honest, with a bucket, with a lota like this, it's very difficult to ensure full cleaning of the private parts. However, you will then ensure that the water is focused in that area. And if you have the hose, then you will be able to, and I have to go from the top because of this, but if I have a hose, I will be able to then hold it from the bottom and underneath and ensure that the private parts are clean in the istinja process. Again, you would not touch the fecal matter. If there's any part of the body that's the most riskiest, then it is the bodily fluids that are coming out from there. You will ensure that plenty of water is used and that this area then is definitely cleaned out as much as possible to ensure that the water is flowing and any fecal matter is removed. The next stage then is to do the wudu for the body itself. Now, it is possible for 2 people to do that. Again, if the bodies are stacking up and if the situation is difficult, then with 1 bucket on each side, the parts of the body will be done. So if I am now doing it myself, again, depending upon how much, like myself, when I'm doing this, I am going to wash the hands. I am physically going to use soap. That's myself. For those folks who are worried, then you do not need to touch. So just based upon someone who is worried and concerned, again, a legal disclaimer that we are saying that itself there is a risk, a small risk of infection from the body which is not able to be quantified, but not enough of a risk to not wash the body. If you are concerned, then you can just pour the water on the hands itself. You start on the right hand side. The Prophet ﷺ, when he instructed the Sahabiyah to wash Zainab, his daughter, radiallahu anha, he said, make ablution for her and start on the right hand side. So we would then ensure that the right hand is washed first, and then the left hand after that. Then it would be the face, and the face itself, because we have covered it and we were able to now actually tie the face mask around, it will be the same as we would do in wudu. So it would be the mouth, and it would just be gentle, just pouring over it, pouring just gentle amounts over the nostrils itself, and then over the face, using a right hand and gently just washing the face, gently washing the face itself. Remember, the nose are covered so water does not get in, and also to prevent infection coming out. Once that is done, then you will wash then the arms just like you would do in the normal process. And again, from those who don't want to actually touch the body, you can just pour the water from the right arm from the elbow down to the bottom, and then likewise then on the left arm. Then you will then wipe over the head. You will wet your hands and wipe over the head of the deceased very gently. And then you will wash the feet. And again, when we're doing this with two people, then one person is doing the other foot and the other one is doing the other foot. And you might say that this is not the continuity of wudu, but in this case, when there's two people doing it, then that continuity is something which is left. So two people would then do that. And that is the process of the actual wudu itself. The next stage then is the ghusl. Now again, the point of this washing is to cleanse the body. But when we say the cleansing of the body, the focus is the ritual cleansing of the body, meaning it's a spiritual cleansing. If we really wanted to clean the body so that it itself is the most safest thing, then we would just spray it with bleach. That would be the obvious thing if the focus was on just having an absolutely clean body. It's a combination of both. It's some level of cleanliness, which is why the Prophet ﷺ would apply camphor, kafur, and use sidr, which is soap, and would use perfume as well. And a combination of the spiritual, which is why we're doing it in order, why we're doing the wudu first, why we started with istinja, why we started on the right hand side. So the spiritual aspect is very important as the haqq of the deceased. Now in our case here, we are talking about a minimum. A minimum would now be that you would take the water and you would wash on the right hand side of the body. The right hand side of the body would mean you'd start in this area here. You would pour, wash, and as I said, another person will be here. So if I'll just give you an example, Ashraf, if you come and show, if you lift the body would be lifted just gently, and it would be just poured, underneath, being poured, underneath like this, very little movement, until the whole part is then poured like this. Put the body down gently, and then we would then do the same. Head, and then the left hand side. Pouring, underneath, pouring, and then ensuring everything is now going further down. All the water being taken down to the dirty part, and that is what would continue. Again, this body is obviously has no flexibility. Now, this is quite hands-on. People would say that I don't want to get involved that much. If you don't want to, then that's something which is your own decision, and you're not sinful for that in any single way. This is not the bare minimum. If you're talking about absolute bare minimum, you could theoretically take all the water and just allow it to flow. Again, a gentle hose is the easiest. If you have a gentle hose and you hold it from this side and allow the water just to keep flowing all the way down and ensure that every stage you just lift the body to ensure all parts of it are wet, then the basic obligation is fulfilled. This is down to the amount of risk that you want to expose yourself to. Myself personally, I will now go further. I will now have my second bucket that will have soapy water in there. And even though I will not be rubbing, but I will use that soapy water, and I will almost definitely pour it in the areas of the private parts, in the areas where we normally would clean, in the armpits and so on and so forth. I will do that with my PPE on that I have, and especially if I have extra PPE on as well. After we have then applied the water, if you do that 3 times, then that's brilliant. If you just do it one time because you want to then stay back and you don't want to touch the body, that's fine as well. But be careful. The further you're back, ironically, you could actually increase the risk of splashes. So you want to have that balance, that you don't let fear completely dominate you, but you make sure that the bare minimum is done, which is just the washing itself. After this has occurred, then you're sure now that the entire part of the body has been washed. And you are able to apply something, but that's not absolutely required. So the kafur itself is acting as an insect repellent. It's actually acting to disinfect the body as well, to allow it to be preserved longer from insects and the like. Once you're finished, then it's about time to dry the body. The drying of the body itself, you would use this cloth to just come up, and you'll get the towel, the towels that you will have, and you will just ensure that this is now being soaked up, the excess water, and then you will gently, because as we said, the guidelines are in a COVID patient, minimal movement. Even though you've got your mask on, don't forget, I've got my glasses on, don't forget, and this is now covered, this has been covered. So genuinely the risk is minimal, which is why they've released that guidance, because they recognize that we have to ensure our rights. And it's not becoming of Muslims who may think that because they are professional or doctors or something like this, that would think that this is backwards, you should just avoid the body, don't touch it. This is not the right attitude. We should do what's scientifically safe. The Muslims are not, ignore the science completely. We go with the science, we go with the research, and the research is, although, yes, I'm not going to say it's safe, because the word safe means zero risk of infection. We've repeated many, many times. Why are you not allowing children? Why are we saying no over 60? Why no comorbidities? Why are there people with no underlying health issues or immunocompromised patients? We're not allowing them to come close. So we're recognizing the risk and trying to minimize it as well. And that's why we're not doing the full sunnah ghusl. The body then will be dried completely and then ready for the next stage, which is the transfer of the body to the other table for the purpose of kafan, shrouding.